Welcome back, everybody, to another episode of Outside the Box, and I am with the Common Sense MD, Dr. Rogers. Dr. Rogers, how's it going?
Great, Ben. Thanks for allowing me to be on the show today. It's
Well,
an honor.
This is going to be fun because this is going to be a little bit of an update, guys. And I caught him. I'm actually with the family on 4th of July weekend, and this past week, you did a talk for. I believe it had something to do with the Senate. It was through Zoom, and I thought for the audience here, we could just kind of go over a little bit what you went over with them. Hopefully, bringing some value to the value you brought to the Senate people. You can bring to the people that are listening to our show. So, just start off by just explaining what did you do this past week?
It was a presentation by myself and another physician out of the University of North Carolina. Infectious disease doc that's professor emeritus at Chapel Hill, and we were asked by the Men's Health Network to present for Congress. It's actually for the staffers of U.S. Congress, so all of them that wanted to learn about cancer prevention. We gave them a talk. Of course, it was over Zoom, but it was pretty interesting. You know, the various aspects about cancer prevention for both male and female, even though it was for the Men's Health Network. We're both on consulting for them. You know, when we went to Walmart headquarters a few years ago, that was one of the things you came with me on that trip. But then we went to the White House one year. But
for the people who don't know, what is the Tennessee Men's Health Network?
It's an organization that is funded nationwide, and our state, of course, kicks in, but it's meant to bring awareness to men's health. Men rank way behind women in terms of health, and it's just kind of a subspecialty organization that tries to bring awareness to men, what they can do to get them to the doctor more, to screen more. Men are much more reluctant to come to a physician than women are, and as we've talked about many times, women are smarter than men. So, it's just to bring awareness to men as far as taking care of their health. So this was just a talk about the most common types of cancer and what you can do to prevent it, as far as primary prevention, which means basically your lifestyle, the things you do, especially what you eat, how active you are, how you sleep, toxic exposures like smoking, alcohol, pesticides, environmental toxins, stress, of course, is one of them. And then secondary prevention, which means screening when you're asymptomatic for diseases. And we took the most common types of cancers like skin cancer, colon cancer, breast cancer, prostate cancer, lung cancer, and we kind of went over some of the things you can do as far as when you should get screened, and things you can do to maybe help lessen your exposure to those diseases, because we've come such a long way in treating cancer. Our cancer rates and deaths in this country are plummeting because, of course, lung cancer is the number one cancer that kills Americans, and there's a lot less smoking now than there was 30 years ago, and the death rates have really come down. Plus, we've got early detection like low-dose CAT scans of the lungs to screen for lung cancer. We used to have just plain chest x-rays, which are terrible for screening for early lung cancer. A low-dose CAT scan picks it up a lot sooner. Plus, we have better treatments. Our treatments for breast cancer now are much better than they used to be. We have targeted therapies now, and so we're making a lot of strides. It made me realize that, it made me refresh on everything that we need to be telling our patients as far as when to go and get screened for these things, what to worry about, what not to worry about, and there's hope that you can prevent cancer from killing you by screening at the appropriate time. Certainly you want to get screened if you don't have symptoms at certain ages, with certain risk factors. But you also don't want to ignore the fact that if you find a lump or you're passing blood somewhere or losing weight or having unexplained fevers, etc., fatigue, then you need to tell your doctor about that and go get worked up for it then. Don't wait for a screening test. But, a lot of our future health is going to depend on these types of screenings that we do, and they're not painful.
It seems like it's really just about being intentional with it and making this a part of your routine, very similar to what the Tennessee Men's Health Network is doing and trying just to get men going to the doctor. Screenings, making this a part of what you do every year, especially once you hit a certain age, is so important. And I'll just add, you did a Common Sense MD on some of these cancer screenings in a very similar type talk that he gave to the staffers for the U.S. Congressman. So we'll link that in the show notes below from this episode. But I'm curious, what sort of questions are you getting when you give a presentation like that? What are people asking, or what do they want to learn more about?
They really want to learn more about how to prevent cancer and live a healthy lifestyle. For example, a lot of what we do at Performance Medicine is, battle obesity and figure out metabolic syndrome, because metabolic syndrome, which means high blood pressure, high cholesterol, and diabetes, or at least insulin resistance, we know it leads to heart disease. The number one killer of Americans, in cancer is second. But a lot of people don't realize that being obese really increases your rate of cancer by a long shot. I think besides smoking, being obese is I would say, the second biggest risk factor for getting cancer. So, and what I do in my practice is try to figure out how to solve that obesity problem for that particular patient, because it's different for everybody. Like I tell all my patients the first time they see me, life is not fair. Your particular set of circumstances metabolically don't equal your best friend or your person that can eat a little bit differently than you can. So what we try to do is figure that out and give you the tools to help get you leaner and overcome that insulin resistance and metabolic syndrome, so that not only will you way lower your risk for heart disease, but you'll lower your risk for cancer as well.
So much of what you talk about, when you talk about just getting to the root of the problem, comes back to this obesity epidemic. And I'm interested, like when you tell patients that, when you tell a group, how much of a consequence it is to be obese, what's the reaction you get? Is it one of like, okay, I feel positive about this, or is it more like almost they're a little down about it? Does it make people feel more in control to know that obesity is such a big issue, and if you solve that, you solve so many other issues?
Yeah, to me it's a kind of a happy thing for them to finally get educated on something that they can be helped with, because as a doctor, you need to be able to give hope, and you can do that if you work through it. It's hard to figure out. I mean, you can't, spend 5 minutes with a patient and give them a script for something that, is going to cure them. It takes a lot of time to get to know them, and do the Cleveland Heart Panel, find out how insulin resistant they are, what their hormones look like, what their inflammatory markers look like. Remember, inflammation causes all disease. So if your gut's inflamed, if you're eating the wrong foods for you, it way increases your risk of both heart disease and cancer. So, you give the patient hope, and you have to realize that obesity is a metabolic disease. It's not their fault, really. It's not a matter of being lazy or something like that. Obviously, they may eat the wrong foods, but it's also a lifelong problem. It has to be treated medically for a lifetime. And there's a lot of things that go into play with that, of course, like psychology of eating, stress, hormones, things like that. But, it's something that you need to treat for a lifetime. And a lot of it starts in childhood. if your kid is obese as a young kid or a teenager, more than likely they're going to be an obese adult and live a shorter lifespan than you are for the first time in history.
Mm-hmm.
We may have our kids living a shorter lifespan than we are. So it all has to do with the obesity epidemic. So, I guess when I went out on my own, that was the main thing that frustrated me with the way we practice medicine. With conventional medicine is we don't go for the root cause of the problem, and we're really not tackling this obesity epidemic right. I mean, when you go to your doctor and at the end of the visit, the doctor says, you need to lose weight. And the patient goes, how? And then the doctor says, it's easy. Eat less, exercise more. Guess what? That doesn't work. It's a much more complex metabolic disease, and you have to approach it like that, or you're just really making the patient feel like a fool, for one thing, and you're also giving them really bad information. So if your doctor does not know what to do, you need to go to somebody who does know what to do, because there is hope out there. You don't have to live your life as an obese person.
There's so many things you do and you talk about, or you can do, and you talk about the tools quite a bit. Getting back to this talk you gave, what was your goal out of the talk? What 2 to 3 messages were you really trying to get across? Was it the right cancer screenings plus the obesity message?
Well, of course, my message is always primary prevention. I
Meaning
think
the lifestyle.
Meaning lifestyle, what you put in your mouth,
Mm-hmm.
how much you weigh, do you smoke, do you drink too much alcohol, risky behavior. So I think the main purpose of them asking me was, of course, to go over the recommendations for secondary prevention, which is asymptomatic screening. But it seems like most people are really interested in more primary prevention, how to prevent that from occurring in the first place.
Which goes back to the obesity epidemic.
Right.
Most of the time.
And lifestyle, what you eat. I still think the most important aspect of your health is going to be what you put in your mouth.
It's really like, even you saying that makes me feel great, because there is some control over that. And even we talk a lot about the complexity of weight loss and weight management. But, even with that, there's things you can do, and there's tools out there, whether that be medication, whether it be, information regarding what foods you eat, how to manage stress maybe a little bit better. There's lots of different tests you can run to see, what tendencies you might have that others don't. So to me, it's really encouraging to know that, solving that one issue can really, create a longer health span, as you talk a lot about.
Exactly right. And, we have a lot of tools to help you overcome this metabolic syndrome. One we talked about recently was the new GLP-1 agonists that, like Ozempic, which we've used for 2 or 3 years and had great success with it. And now Wegovy, which is aimed purely for weight loss, not even in diabetics. So, we've got a lot of great tools out there to help you, and you do need help. I mean, I don't know if I've ever met a patient that could do it by themselves. It's just way more complex than that. So what my job is to make your path easier and to guide you along that path, and then to keep you on it, because it's a lifelong condition that you have to be aware of and treat.
In regards to weight loss and obesity, you've always said you need 3 things. You need, number 1, you need a reason why. Number 2, you need a tool to get there. Number 3, you need some sort of accountability.
Yeah.
And would you stick to that? I know it's been years you've been saying that.
Yeah, right. That's a pretty good way to sum it up. So, but yeah, so it was fun talking to the Senate, and all. And, they never want us to get too political, which I wouldn't do anyway on something like that. So it was a good, just non-biased talk about, cancer prevention, really.
Well, you're super outside the box. Did it seem like they were receptive to some of the outside the box ways of looking at cancer and, staying healthy?
Yeah, I think so. From the feedback we got, but it's always kind of tough when you're doing Zoom. They haven't really reopened Congress to speakers yet, so it's always better when they meet you in person and you can feel your audience out, and then they can come talk to you personally after you talk. So, I just hope our country can open back up to where we can have a lot more in-person meetings, and because I think some of the Zoom and some of that really takes away from the interactions that you get. But maybe next year, we'll be back in Congress talking to them.
Well, it's super cool. We're super proud of you for making that presentation. And for those who want to dive a little bit deeper on some of the asymptomatic screening for cancer, you can check out that podcast episode on the Common Sense MD. That'll be linked in the show notes below. As always, this is Outside the Box. Dr. Tom Rogers. I'm your host, Ben Rogers. Thank you guys for hanging out. And as always, we will see you guys next time.
No, don't go away.